Medical report sample 2. Patient information. Name, Mrs. and Natal Fras. Age, 52. Gender, female. Medical history, hypertension, diabetes type 1. Admission details. Date of admission, November the 22nd, 2023. Admitting ward, cardiology. Reason for admission, chest pain. Clinical presentation. Presenting complaints. 4:48 hours before admission, the patient experienced sudden chest pain and shortness of breath. She was initially admitted to a local hospital, diagnosed with acute street elevation myocardial infarction, STEMI. She was transferred to FF Hospital. Following this, she underwent percutaneous coronary intervention, PCI, with the placement of one drug-eluting stent, DA, at LCX. Subsequently, she is now under the care of the cardiology department. Medical history, hypertension, diabetes type 1, assessment and initial findings, ECG, sinus rhythm, Q&DII, DII-F, echocardiography. The echocardiographic examination revealed severe hypokinesia, localized to the inferior wall of the left ventricle. The ejection fraction, a measure of the heart's pumping efficiency, is calculated at 50%, indicating a moderately preserved systolic function. Importantly, all heart valves were found to be normal in structure and function. Discussion. Severe hypokinesia suggests impaired contraction of the myocardium in the inferior segment of the left ventricle. This may be attributed to compromised blood supply following the acute myocardial infarction. The ejection fraction of 50% falls within the range of moderately preserved systolic function. Notably, the normal function of heart valves is indicative of unimpaired blood flow through the chambers of the heart. Percutaneous coronary intervention, PCI, report. Procedure details. Vascular access, right femoral artery, guiding catheter, JL 3.5 guide catheter, DSA, occlusion in LCX, lesion location, proximal LCX, lesion type, occlusion, devices used, guide wire, balloon catheter, and drug-eluting stent, DA, stent type, 2.75 x 18 mm drug-eluting stent, example, Zine Sierra. Procedural details. Lesion crossed with a guide wire, example, run through an S. Predilatation performed with a 2.5 x 15 mm semi-compliant balloon. Drug-eluting stent deployed at nominal pressure. Post-dilatation performed with a 3.0 x 15 mm non-compliant balloon. Procedural success. Complete resolution of the occlusion with TIMI 3 flow achieved. Post-procedure findings. Aniographic result. Excellent aniographic result with restoration of antegrade flow in the LCX. Complications. No procedure-related complications observed. Post-PCI medications. Dual antiplatelet therapy initiated with aspirin and a P2Y12 inhibitor, example, clopidogrel. Follow-up plan. The patient is advised on lifestyle modifications and scheduled for regular follow-up appointments. Conclusion. The percutaneous coronary intervention was successful in addressing the occlusion in the proximal left circumflex artery. The patient is stable post-procedure, and appropriate medical management and follow-up care have been instituted. Interpretation. The PCI effectively treated the occlusive lesion in the proximal LCX, and the use of a drug-eluting stent is expected to reduce the risk of restenosis. The patient will be closely monitored for clinical progress, and further interventions will be considered as necessary. Management plan. 1. Dual antiplatelet therapy. Commence dual antiplatelet therapy to reduce the risk of further thrombotic events. 2. High-density statin. Initiate high-dose statin therapy to manage dyslipidemia. 3. Insulin. Continue and adjust insulin therapy for diabetes type 1. 4. Cardiac rehabilitation. Enroll in a comprehensive cardiac rehabilitation program. Prognosis and follow-up. The patient will be closely monitored for treatment response and potential complications. Collaboration with specialists, including endocrinologists, will be sought for comprehensive care. Regular follow-up appointments will be scheduled to assess cardiac function and overall health. Conclusion: Mrs. ANF, a 52-year-old female, was admitted on November 22, 2023, to the cardiology ward due to chest pain. The initial diagnosis revealed an acute inferior street elevation myocardial infarction, STEMI, managed with successful PCI and deplacement at LCX. The prognosis and ongoing care plan include close monitoring, medication adjustments, and participation in cardiac rehabilitation. Doctor name: